Hi YouTubers. Today is March 10th, 2020, and I wanted to do a little opinion video on COVID-19, and this is regarding telemedicine during this outbreak. Now, our pediatric practice has been struggling with how can we continue providing patient care in an outpatient setting in a pediatric practice and not expose ourselves and our patients to the virus. And this is very difficult because you have sick people coming through the office every day, many of them who have respiratory illness, and as you know, the symptoms of COVID-19 are indistinguishable from a common cold or a flu, and so we can't tell who they are as they're coming in. And although they say the tests are available, we still do not yet, as I speak, have the ability to just unrestricted order a test and get a result. Yeah, we can, but you have to jump through so many hoops and wait so long. For all intents and purposes, we're not quite there yet. So what can we do? And one of the thoughts I had was, just as I'm speaking to you through video and audio, if I were to be able to have access to telemedicine, which means video conferencing, where I can see and speak to the parents and the patients, I could provide most of the services that I provide in person. There would be zero transmission between the patients and myself, and there would be the family would not be exposed to an environment which potentially could expose them to the virus. So why not just do it? I mean, lots of people have Skype, Facebook messaging, WhatsApp, various applications for video conferencing. And also there are commercial products available for providing telemedicine in physician offices. The bottleneck or the block in doing that is reimbursement for the services. The pediatric practice has to pay its staff, has to buy supplies, etc. And if we don't get reimbursed for the services we provide, we go out of business and we're no longer there. So my thought today was, just as the government is contemplating continuing employee salaries if people have to stay out of work during self-quarantines or business temporary shutdowns due to the virus, the government can mandate that the medical insurance companies like Blue Cross Blue Shield, Aetna, or whatever, reimburse physicians for providing their services via telemedicine. Now, many of these are already set up and approved for certain special settings, but for the average pediatric practice and other family practices and all, they don't have this set up and it's not available. But the government could mandate that, at least temporarily until we get our act together, that these services be reimbursed by the insurance companies, and that could instantly provide a social distancing, a separation, so the germs can't move from one person to another, and buy us some additional time to figure out, okay, What's going on here? What maybe we can fine tune it. I mean, we still haven't had tests available to do general population testing like I recommended in my last COVID-19 video. That information is not available. We still don't know the denominator. We don't know how many people are running around with this out there because we haven't been able to test. And I mean, we haven't even been able to test the sick people, let alone the general population, some of whom are not sick. So, so my thought is, okay, as part of an overall strategy to limit the spread, they're closing schools, they're going to have sporting events where fans don't attend, etc. But what about physicians' offices? I mean, this is where the sick people go. And some of those sick people are going to have coronavirus. So how do we keep those people from spreading it among themselves? And this is one way, I believe, by mandating that the insurance companies reimburse physicians for providing their services via telemedicine, that we could further limit the spread of this virus while we're getting our act together. Well, anyway, that's my thought for today. Thanks for watching.